The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
February is American Heart Month, so here to share why it's so important to know your heart, we welcome back cardiologist and medical director of Women's Heart Wellness at Providence Heart Institute, Dr. Lori Tam. Good morning, doctor.
Good morning. Thanks for having me.
You bet. Cardiovascular disease is still the #1 killer of women worldwide, right? But is it preventable?
Yes, about 80% of heart disease is preventable by how we move, what we eat, how we live. We know that eating a healthy diet, exercising, avoiding smoking, and maintaining a healthy body weight reduces your risk of heart disease.
So when do we start to recognize that there's some heart problems that may be happening? I understand that for women, a lot of times it can be a pregnancy.
Yeah, so actually, heart disease is the #1 killer of new moms, actually.
Oh.
And cardiovascular disease accounts for about 1/3 of maternal mortality. We know that Black women particularly have the highest rates of maternal mortality in this country.
So you want us to understand how women can notice heart attack symptoms. So let's talk about what they are and how to recognize them, because they don't present in a typical way that we might think. Like it's not really your heart, like you don't feel your heart. Is that right?
Not always. Some sort of chest discomfort is still the #1 symptom women will complain of or notice when they're having a heart attack. But sometimes women feel it differently. You can have a discomfort maybe in the neck or the jaw. Sometimes women complain that they're having epigastric discomfort in the upper abdomen. They might think it's heartburn. Sometimes the pain goes into the arm. So there can be referred pain that is felt differently. Women sometimes also complain of shortness of breath rather than chest pain, sweatiness, nausea. So there's other associated symptoms that are sometimes more common in women.
Wow, well then how do you know what's happening?
Well, I think that if the symptoms are clearly different than your baseline, especially if exertion is triggering some of those symptoms. So if walking up a hill, you're getting tightness and pressure, jaw pain, arm pain, those things are really important to pay attention to. But if things just don't feel right, you want sure that you address it, that you seek medical attention promptly.
And you say too that heart disease also looks different for women.
It can be, so we know that there are different risk factors at different times of life that can increase your risk. We know that women who have pregnancy-related conditions such as gestational diabetes, preeclampsia, gestational hypertension, or even a baby that's small for gestational age or premature delivery, we know that those women are at higher risk for heart disease later on in life, at least 2 to 3 times higher for heart attack and stroke. So identifying these women early really gives us an opportunity to treat them earlier and manage the risk factors earlier. We also know that there are certain heart attacks that are more common in women. Atherosclerosis or plaque buildup causes the majority of heart attacks, but women can have heart attacks from other conditions such as spasm of the arteries of the heart, something called spontaneous coronary artery dissection, where there's a tear in the blood vessel of the heart, microvascular disease, or even a condition called broken heart syndrome, Takotsubo cardiomyopathy, where extreme levels of stress can cause heart attacks.
Wow, I find the broken heart syndrome so fascinating. I mean, it's an incredible story. Going back to what is preventable, what should we be doing?
So, it's really important to be active and to be proactive. So I think that there are certainly diagnostic tools that we have in addition to managing cholesterol, blood sugar, blood pressure, all those things. Sometimes we do a test called the coronary calcium score in certain individuals to look at calcified plaque burden to make sure that they don't have a lot of plaque buildup even before they have their event. You're trying to identify their risk. Not everybody needs a coronary calcium score, but in the right individuals, maybe someone who's got high cholesterol or a family history of heart disease, it can be very helpful in helping us identify your risk much earlier.
I know you're leading a wellness talk, so tell me about that.
We're hosting a women's wellness workshop here at Providence, St. Vincent Hospital. We have spots. We have a few spots in person, but at this point, mostly virtually as well, where we are going to be sharing, having a panel of both gynecologists, obstetricians, internal medicine, as well as cardiology, talking about women's health, wellness, and screenings throughout the lifespan.
That's awesome. We want to tell everyone, if you would like to find out more, we're going to tell you about all that information about the Women's Wellness Talk Tuesday, February 18th at 6 p.m. We'll give you all the details on how you can find out more on our website at katu.com/AMNW. Dr. Tam, thank you so much. Great to speak with you again.
Thanks again.
You bet. All right, we'll be right back with more AM Northwest. Don't go away.